Tyler Kowalczyk Foundation presents ADHD Angels, documenting the children's lives stolen by ADHD medications. This is the story of Shaina Dunkle. Shaina Dunkle from Pennsylvania was a little girl whose life was filled with dance classes, Girl Scouts, piano lessons, and softball games. However, in 1999, when Shaina was in the second grade, teachers believed that she was too active and talked out of turn. Her mother, Mrs. Vicky Dunkle, was pressured by the school psychologist to have Shaina evaluated for ADHD. Vicky Dunkle said, "We felt extremely pressured because Shaina was being made to feel different by her school. She frequently was isolated in the hall to do her schoolwork, and at one point her desk was dumped upside down in front of the class by her teacher because it was messy. These experiences left my daughter humiliated and deeply hurt. She reacted to these actions by her school by telling me she did not want to go. She started having nightmares and started complaining of being sick to avoid going to school." Vicky Dunkle continues, "School is supposed to be the place where we as parents feel safe about sending our children to. My daughter no longer felt safe. She no longer felt secure or happy about school. She was only a second grade student. The psychologist referred Shaina to a psychiatrist who, after a 30-minute evaluation with no tests or physical exams, diagnosed her with ADHD and prescribed a psychiatric drug. Then, later, 2 more. On February 26, 2001, the school nurse phoned Miss Dunkle to report that Shaina had suffered a slight seizure and had fallen out of her seat. Miss Dunkle took her to the doctor, but while there, Shaina began convulsing. Her mother rushed to hold her in her arms, where minutes later, she died. Shaina was 10 years old. As I held her in my arms, she looked into my eyes as her life ended, and I knew I could do nothing to save her. If I had followed my heart instead of the advice of professionals who thought they knew my daughter better than I did, my precious Shaina would be alive now." The medical examiner's final report concluded that the main cause of death was despermine toxicity. Shaina had an excessive amount of the drug despermine in her system. She also had a history of urine retention and kidney problems. Despermine is not meant to be given to children with a history of either of these. Her body was not excreting the drug properly, and it was building up a toxic amount until she went into a cardiac arrest. Our daughter's death has not only left us to deal with the guilt of believing in the so-called professional system, but anger that we were not warned properly about the drug's side effects. We were never told that this drug had not been approved for children under the age of 13 because of its safety and its effectiveness had not been thoroughly tested. Why are parents not being warned properly about drug side effects? Why are parents being pressured from within the school system? Why do physicians get away with the prescribing of dangerous drugs not FDA approved because the safety and effectiveness have not been safely tested in children? Why are innocent children dying from mind-altering drugs for a diagnosis that has never been proven? All of these questions are valid and need answers. Children on mind-altering drugs become children that their parents don't even recognize. As parents, let us work together to prevent more Shaina-like tragedies from occurring. Unfortunately, this child is not alone. These medications are currently hurting and killing children all over the world. The truth is, no one actually knows how many children's lives have been taken, due to the deaths most often being reported as occurring from natural causes, as it is almost impossible to prove the medication was the sole contributing factor. The end result, however, is still the same. The child is gone. The family is broken and left with so many unanswered questions. We here at Tyler Kowalczyk Foundation implore you to find holistic, safe alternatives, and do not give up until you find the one that works for your children. Warning: please never stop any psychotropic medication without first consulting your child's doctor, and allow them to closely monitor the detoxification, as cutting these medications suddenly can lead to severe harm or death.